Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Montpelier Family Dentistry in Laurel, Maryland, discussing the benefits of dentistry with one of this region's top dentists, Dr. David Koilpillai. Dr. Koilpillai received his DDS degree from the University of Maryland School of Dentistry. He is a member of the Academy of General Dentistry and the Academy of Dental Sleep Medicine. Dr. Koilpillai is recognized as one of this region's top dentists. Welcome, Dr. Koilpillai.
Thank you. It's a pleasure to be here.
Oh, it's our pleasure to have you on our program. We've got a lot to talk about regarding a number of benefits that can be gained from dentistry, especially with the technological advancements that have taken place in the last few years. And you have a number of specialties here at your practice that you're widely recognized for within your field. And I wanted to begin by asking you about wellness, because that's a specialty here that's quite well known, and I wanted to have you tell us about the benefits of dentistry, beginning with the wellness component.
Okay, yes. You know, if you can say that the eyes are the windows to the soul, well, the mouth can be the window to the rest of the body. And what affects your body can affect your mouth, and what affects your mouth can affect the body. So there's a connection there between the mouth and the body, and it's all one. So we like to look at the whole person in our practice.
Sort of like a holistic approach in a sense as well.
In a sense, yes.
As far as the totality, how everything within our body, like you just mentioned, the eyes, the mouth, everything all working in conjunction and affecting the other parts of our body.
That's right.
And if something is out of alignment or out of whack, if I may use that term, then it can throw off our whole being, actually.
Especially the gums. 3 out of 4 people suffer with gum disease sometime in their lifetime. And if the
That's significant.
That is a significant amount. And if the gums are not healthy, that can be an entry port through which bacteria enters the bloodstream. And it's thought that infections can get into the bloodstream, which can start a blood clot, which can lead to a stroke, heart attacks, and this is still being researched, but this is the thought that's going behind that. The other thing is that those with gum disease and those who are diabetic, one affects the other. If the diabetic's blood sugar is out of control,
yes,
then the gum disease can worsen. And if gum disease is not controlled, the blood sugar can be increased in a diabetic. So one affects the other.
Yes, indeed. And what you just mentioned there obviously expounds on the fact that there could be some very serious health consequences from something like gum disease, for instance.
That's right. And so we do a thorough medical questionnaire on their health history. We do a thorough exam, including we screen everyone for gum disease. And we make the appropriate referrals, maybe sometimes back to their physician if their diabetes is not under control.
Another area, Dr. Koilpillai, that your practice, Montpelier Family Dentistry, specializes in is sleep apnea. And that's a problem that afflicts many, many folks out there, and also can have some very serious consequences. Obviously, a lot of us are familiar with the Reggie White, a former NFL great football player, Hall of Famer, who died of sleep apnea years back, and many folks do, unfortunately and tragically, each year. Can you tell us about your practice and the focus on sleep apnea as well, and how you can help people with that problem?
Sure. Yes, as you know, sleep apnea is a condition where the individual may stop breathing while they're sleeping, and may happen several times during the night. And this can be very dangerous. It can result in cardiac arrest at the worst. So it's important that it be treated. And many people are being treated for it with a CPAP machine is the standard of care. But there are many people who cannot tolerate wearing the mask and going to bed with that. So we have an alternative treatment, which is a dental appliance that they would wear, which actually keeps the airway open without the cumbersomeness of the mask that the CPAP machine incorporates.
Oh my goodness. So this dental appliance obviously is a lot more comfortable to have on when one is sleeping.
That's right. And it can treat mild to moderate sleep apnea.
Oh, that's certainly very interesting and good to know.
Yes.
Now, for the folks out there who suffer from this problem, can you tell us what what's the typical process that they would go through if they came to a dentist like yourself?
Well, first of all, they would have to be diagnosed by their physician for sleep apnea. They would have obviously gotten a sleep study already. And from that point on, if they're diagnosed with mild to moderate sleep apnea and they're agreeable with that is agreeable with the physician, we can go ahead and treat them by taking some impressions or molds of their teeth, getting an appliance made for them, and then getting that appliance adjusted so that it is comfortable and they can sleep comfortably.
And a lot better and less likely to have that problem once they start wearing that appliance.
That's right.
Well, that's certainly very good to know as well, doctor. And because as we mentioned before, there's a lot of folks out there who suffer from that problem, and it's good to know that if they have the slight to moderate version of sleep apnea, that there's a dental appliance from a specialist like yourself that can certainly help them a lot and alleviate that problem.
That's right. It can be a great help to them.
We're now going to meet another patient of Dr. Koilpillai who had the sleep apnea dental device. Welcome, Julie.
Thank you. It's nice to be here today.
Oh, it's great to have you on as well. We love it when patients come down. And just like the prior two, I'm so happy to have you on as well. So let me just begin right off the bat, if I may, by asking you, I understand you had sleep problems, were you difficulty sleeping, and you had sleep apnea treatment done here through Dr. Koilpillai?
Yes, I did. I've been snoring for a long time, and I had my doctor recommended a sleep study be done. And one of the treatments that was recommended was either a CPAP machine or a dental appliance. I have slight to moderate sleep apnea, and I decided to go with the dental appliance because my family travels a lot and it's more convenient for us.
Oh, so that's what you had done to correct the sleep apnea problem, and how were the results?
It's worked really well. I've stopped snoring.
Well, that's big.
So that's good. My husband's happy.
Yes, yes. That's wonderful. And when you came in and met the doctor, and then obviously he diagnosed a specific problem, and then the specific treatment here, in this case being the dental device for sleep apnea, was it pretty much instant, the results, or did the snoring get reduced over time? How did it work for you?
It took a few days for me to get used to it, and the snoring decreased a lot.
That's wonderful. And like you said, I'm sure your husband's very happy as well.
He is.
And I take it you would recommend Dr. Koilpillai to anyone out there who's having sleep issues, sleep-related problems, along those lines that could be corrected with this dental device?
I really would. It really helps a lot.
Oh, that's wonderful. And nothing better than a good night's rest. And you obviously have your energy back.
That's true. I do.
No more sleepless nights.
No more sleepless nights. That's good.
Well, thank you, Julie, for sharing this with us and joining us as a guest. It was our pleasure, young lady, having you on.
Thank you very much.
Now, Invisalign is another area which offers benefits of a major level to folks out there who have crooked teeth, uneven teeth, and certainly need their teeth straightened, i.e. the normal treatment option would have been braces. But Invisalign, in a simplistic form from what I understand, is invisible braces. It's basically braces, but virtually invisible for the busy, and certainly can benefit the busy professionals out there, folks out there who are in the public eye, so on and so forth, who don't want people to know that they have an appliance in their mouth, on their teeth, that's actually correcting those crooked teeth.
That's right. Invisalign is a clear aligner that fits over the teeth, upper and lower teeth. And over a period of 2 weeks, the individual would wear one aligner, then switch to a second aligner in another 2 weeks. And this is an aligner that they would wear all the time, except when they're eating or when they're brushing their teeth or flossing, they would remove it. But pretty much all the time they would wear this. It makes it easier to wear this and be able to remove it while they're eating, versus braces. It may be difficult to eat certain types of food. Food may get caught in there.
Yes.
Yes, and it can help straighten crooked teeth, crowded teeth, reduce the spaces between teeth. It can also increase the efficiency of chewing, because the bite can be changed. And also, it can make it much easier to maintain healthier teeth and healthier gums if your teeth are straighter.
So certainly some major benefits there from Invisalign over the traditional orthodontic treatments that have been utilized over the last many years.
That's right.
We're now going to meet one of the doctor's patients who had an Invisalign treatment done. Welcome, Dave. It's great to have you on. I wanted to begin by asking you, what dental problem or problems were you experiencing prior to coming to Montpellier Family Dentistry?
Well, actually, to tell the truth, I had a lot of problems. Actually, I had teeth alignment problems. There was some pain. Had some issues, way past issues, where other dentists did not do pretty good work or whatever. And I just went on, just lack of knowledge or whatever. And so I happened to come to here, and I was very pleased. He did very good work. He covered everything. So it was great.
And what did you have done through Dr. Koilpillai?
Well, let's see. There was in the past, well, let's say maybe a long while ago, maybe like 15 years ago or something like that, I had one tooth extraction, and the dentist removed a tooth, and nothing was put into place.
Through the other dentist?
Through the other dentist,
yes.
And there was a space there. And so as time went on, I was just thinking it was going to fill up and all that kind of thing. And that presented a problem as time went on. And I came here, and Dr. Koilpillai, took care of it. Did some aligning and kind of rearranging a little things, some things in there, and it worked out great. It worked out great. Then I had some pain, and had another dentist that had some pain. He had a crown put in, and he didn't do that correctly, and Dr. Koilpillai corrected that. And
so basically you had, as you mentioned here a few moments back and also just now, you've had other problems, you've had dental problems really related to not very good dentistry work done on yourself through other dentists, and then you came to Dr. Koilpillai and he basically fixed those problems.
That's true.
And now you feel good?
Oh yeah, I'm great. I got a smile, and feel good about myself.
And I understand you also had Invisalign.
Yes, had Invisalign. That worked out great too. Had some aligning problems, and
so they straightened those teeth?
Straightened those out also. Yeah.
That's wonderful.
It is. It's great.
And you're happy and pleased with everything.
Absolutely. Absolutely.
Well, on that note, I'd like to thank you, Dave, for joining us as well and being a guest on A New Me.
Thank you. My pleasure.
Our pleasure. Now, as far as the treatment process, is it the same length of time as far as wearing the Invisalign appliance that one would typically have as far as braces go, or can you elaborate on that?
Well, according to the Invisalign company, the company that makes the Invisalign aligners, the average length of time someone would be wearing this is about 11 months. And about 70% of those who have orthodontic treatment qualify for Invisalign treatment. So that's a good option for them.
Well, that's certainly very good to know, Doctor. And I also wanted to touch on another important area that a lot of folks come to a dentist for these days, cosmetic dentistry. Porcelain veneers, whitening, so on and so forth. And I wanted to ask you if you can please tell us some treatment options that are available, some of their benefits for the viewers that are watching as well.
Sure. The porcelain veneers are very thin porcelain facings that go on the front teeth. They actually get bonded or cemented onto the front of the teeth. They can very easily change the color, the shape, or size of the tooth. This can be done in a matter of two visits, and you can instantly change the look or the smile of the individual.
You're looking at a new me then, right?
That's right.
Literally.
That's right. It can completely change the way your smile looks. So if an individual isn't happy with the way their smile is, they don't like to smile for the camera, this is a very good way of changing their smile.
And who would you say would be a good candidate for some of these treatment options that you just touched on in cosmetic dentistry?
Those who have, let's say for instance, those who have worn their teeth down, so they're not the same size, those whose teeth have become discolored over the years, they have changed the position of the teeth, these are individuals that could benefit from the veneers.
Okay, no, that's certainly interesting, and I appreciate you letting us know that. There are a lot of folks that fall into that category
That's right.
out there, obviously.
Yes.
And I understand there's some patient before and after pictures, Dr. Koilpillai,
Yes.
that you have for some of these treatment options that you've described thus far?
Yes, we do.
Let's take a look. Some very impressive results, Doctor. And what I find from some of these pictures that we just saw from the work you've done is the natural look. Not only a huge improvement, which we certainly see in the after pictures from the before pictures after these treatments were done and performed, but nobody looks like they were done. It looks very natural, and I think that's very important for folks.
That's right. Most people want a natural look. They don't want it to look jarringly different from the way they used to look, but somewhat natural and the way they used to maybe look before things changed in their mouth.
We're now going to meet another patient of Dr. Koilpillai's who had dentures. Welcome, Vaughn. How are you?
I'm great. It's good to be here.
Oh, it's our pleasure to have you on A New Me. Always appreciate it when guests take time in their busy schedules, patients specifically like yourself, to come down and share their experience. So let me begin by asking you, Vaughn, what dental problem or problems were you experiencing prior to coming to Dr. Koilpillai?
Well, basically, I've been trying to get some dental work done for a while now, and a friend of mine had referred me to Dr. K, as I call him. I need some...
That's a cool nickname.
Dr. K.
Yeah.
It's almost like Dr. J, but anyway, Dr.
There you
K.
go.
And they referred me, and we started out with a cleaning process. And from there, he diagnosed me and said, well, let's work out a plan of what we want to do with your whole entire mouth. And I need the uppers and lower dentures. And we looked at it, and we worked out a plan. And each session, we did this, and a little that. And everything sort of worked out. I was very pleased. One of the things that I was impressed with, the fears of going to a dentist. Most people have fears of going to a dentist. I had no fear at all. It was a pleasant visit every time I came in. No pain, of course, and everything sort of worked out.
Yeah, it's right. That fear, as you well brought up there a moment ago, is right after death and taxes, literally, Vaughn. So, but yet we need to go to the dentist, right?
Exactly.
You need to.
Oh, yeah.
You can't go your life without going to a dentist.
You have to.
Or all sorts of major problems occur. So, obviously, you came. You're very pleased with the results. You had dentures.
Right.
You can do a lot of the things that you used to be able to do that you couldn't prior to coming to the doctor.
A better smile, for one thing.
There you go. There you go. Well, your smile looks great, and I'm so happy for you.
Yes.
And thank you for joining us and being a guest, Vaughn.
Great, Joe. Nice being here.
Dr. Koilpillai, we are literally out of time. We've only got a few moments left, and I wanted to ask you before I let you go. You and your practice, Montpelier Family Dentistry here in Laurel, Maryland, have established a reputation for excellence, quite honestly, in the field of dentistry. You've touched on some of the specialties that you focus on and all the many benefits that folks out there who have various dental problems can gain from coming to a dentist like yourself and treatment options that are now available to them. I wanted to ask you if you could let us know, what would you say helps separate you and your practice apart from many of the others in this area?
We are very interested in the well-being of the whole person, and that is what I am very concerned about. We look at the whole individual. So we start with a thorough medical history, and we ask very important questions on their background. So we want to know where they're coming from, how we can help them live a healthier life, including better dental health. So that is part of our focus.
And from what we found also on our end, as far as some research, your practice really cares, Doctor. Rebecca, your office manager, and the other ladies here, not to mention yourself, of course, really care about the patients. It's like a family atmosphere from what I've seen. You treat everyone like you would want to be treated, and I think that says a lot in this day and age.
Yes, and we've been in practice here for over 20 years, so we have many individuals who have been coming back to us, their families, their children. So yes, it's like a family here. We enjoy seeing our patients, talking to them, getting to know them, and helping them achieve better health, dental health included.
Yes, indeed, and not to mention this beautiful new office that you have here in Laurel, Maryland. I mean, you've moved recently, and this is gorgeous. I wish it was like this when I was younger going to a dentist. You certainly, from the beautiful facility to the folks here that work with you and yourself, Doctor, it really, I would feel very relaxed coming here, because a lot of folks have a fear of going to the dentist. It's a very high fear in many cases,
That's right.
But to know that there's someone that's very relaxing and soothing and very well qualified, knows what he's doing like you do, and a lot of folks here at your practice, of course, I think it really helps one get over the anxiety that it would that normally takes over when you're looking to go to a dentist, and realizing just how important it is to go to a dentist, because dental health, as you said, really results and helps us in keeping very good overall health as well.
That's right, yes. And we like to have a relaxing atmosphere here. We get to know the individual. We get to know what they need. We come up with a customized treatment plan for them that is tailor-made for them.
Yes.
And so we're into providing an individualized treatment for that person.
Well, on that note, we'd like to thank you, Dr. Koilpillai, for joining us, being a guest on our program, and we'd love to have you back on again in the future.
Thank you.
Thank you.